Hi, I'm Dr. Richard Norris, a specialist in musicians' injuries. I'm also the author of the book, The Musician's Survival Manual, which can be found on the website wwwdotmusiciansurvivalmanualdotcom. I'm going to be speaking today on the topic of returning to play after injury. All too often, when a musician is recovering from an injury, they're given very vague advice on how to resume playing their instrument. I'm going to cover the specifics on how to accomplish this in a safe and effective way. We'll cover both injury and instrument-specific topics. In the first place, before I'll allow a recovering musician to pick up and play their instrument, I'll suggest that they be able to shadow play for at least 15 to 20 minutes without pain. Shadow play is similar to air guitar and allows one to simulate the posture and position of playing one's instrument without the weight and physical stress of the actual instrument. Likewise, mental practice includes studying the score or sheet music and also visualizing oneself going through the motion of playing one's instrument. This latter is very popular in the field of sports medicine. If one is unable to play one's instrument due to injury, the musician can at least use their downtime to good purpose by honing their sight reading skills, working on music theory, solfege, which is basically singing the names of the notes, and critically listening to recordings of the piece one is going to be learning. In this manner, one stays connected to one's music despite being unable to play one's instrument. During the Return to Play program, one could avoid losing momentum during practice by using a tape recorder, taping the practice periods, and then listening to the recordings during the rest periods. This not only facilitates the Return to Play program, but also enhances one's practice. The Return to Play program focuses around progressing back to full practice and performance by progressing along three parameters: time, tempo, and technical difficulty. One would only progress along one of these at one time. The Return to Play schedule focuses around the time element, but tempo can be gradually increased using the metronome, and for technical difficulty, one starts with easy pieces and gradually works up towards more and more difficult pieces. It's always important preventatively to avoid playing the most technically difficult passages over and over again in order to avoid causing or aggravating overuse injuries. The schedule presented here represents only one way to accomplish this. One should feel free to make variations on this as needed. In this particular example, there are 9 levels consisting of alternating play and rest periods. If you look down the vertical column of the first play period, you can see that the periods gradually get longer and longer, but never exceed 50 minutes, and the rest periods get shorter and shorter, but never less than 10 minutes. In other words, at the maximum, you play 50 minutes and take a 10-minute rest, no matter how many hours you put in. Here, level 9 represents about 3.5 hours of playing time. If one requires more time than this, one can simply add a level 10, 11, etc. However, in my opinion, it's rarely justified to put in more than 4 hours a day or so at the physical instrument due to increased risk of repetitive motion injuries. If one wants to put in more time, one should consider spending the extra time studying music theory, sight reading, etc. I often remind my younger students that there's more to being a musician than just having great chops. If one is unable to successfully progress from one level to the next due to pain, one should consider inserting intermediate levels that I refer to as micro-progressions. In the example shown here, instead of increasing from a 15-minute play period to a 20-minute period when going from level 3 to level 4, 2 or 3 additional levels are inserted in between, up to a minute or 2 each. The same is true for the rest periods, decreasing by a minute or 2 each. If at any point in the program pain increases with successive levels, simply drop back 1 or 2 levels until the pain subsides, and then begin again. Now we'll discuss instrument-specific and injury-specific protocols. Carpal tunnel syndrome. Please refer to Chapter 8 of my book for details on this problem, which include diagnosis, treatment, and anatomy of the region. For example, if one plays the harp and is recovering from carpal tunnel syndrome of the right wrist, one should initially avoid playing on the higher strings. As you can see in this picture, when playing on the higher strings, which are the shorter strings, the undersurface of the right wrist is pressed up against the instrument, and this can put pressure on the carpal tunnel. One might begin practicing avoiding this position and gradually work up towards it. If a violist is having left-sided carpal tunnel syndrome, one would initially avoid playing in the higher positions, especially on the bass or lower strings, due to the degree of left wrist flexion involved, as one can see here. For the guitarist, one should avoid chords that require large stretches, or barred chords, due to the amount of wrist flexion that this entails. One could work around this by utilizing a capo, a small device seen here above the left index finger. This enables one to play the same chord with less of a stretch, as the frets are closer together higher up the neck. Alternatively, and perhaps preferably, one can simply transpose the chord higher up the neck of the instrument to accomplish the same thing. This is also a very good musical practice. Rotator cuff tendonitis and shoulder bursitis are covered in Chapter 6 of the book. In the illustration on the right, the very topmost line says Subdeltoid bursa. If you follow the vertical line down, you see a collapsed structure outlined in blue. That is the bursa, which is a collapsed sac of tissue that secretes lubricating fluid. Directly underneath that is the white structure that says supraspinatus tendon. That's the top of the rotator cuff, which is a grouping of tendons that hold the ball of the shoulder joint into the socket. In this picture, you're looking at the right shoulder from the front. If a cellist is recovering from right shoulder problems, he or she would initially avoid bowing out to the tip of the bow, especially on the treble strings, as seen here. This is because in this position of abduction and internal rotation, which is what we call that shoulder position, the rotator cuff is put into a stressful position. It tends to pinch the bursa and the cuff. One could gradually work up to this position, but avoid the last third of the bow to begin with. For the violinist and violist with right shoulder problems, one would initially avoid bowing out to the tip of the bow on the lowest strings for the same reason. Again, it puts the shoulder into the position of abduction away from the body and internal rotation, turning inwards. If a violinist or violist has left shoulder problems, one would initially avoid playing in the higher position on the lower or bass strings. This is due to the fact that one has to swing the left elbow underneath the instrument across one's body and towards the right hand in order to reach this position, which in turn can put a lot of strain on the left shoulder. If a harpist has left shoulder problems, one would initially avoid playing the lowest strings due to the extended position of the arm, in other words, reaching out, and the stress that this puts on the left shoulder. Ulnar neuropathy. This condition is also known as cubital tunnel syndrome and is covered in Chapter 7 in my book. Ulnar neuropathy refers to compression of the ulnar nerve. The ulnar nerve can be seen in this picture on the left-hand side as the yellow structure. In this picture, you're looking at the back of the right elbow. The ulnar nerve is also sometimes referred to as the funny bone because it's very sensitive and superficial, but when you whack it, it's anything but funny. Pressure is put on the nerve with increased amounts of elbow flexion. Elbow flexion refers to the position such as bringing the fist towards the shoulder. It bends the elbow, basically. So if a cellist or bass player is recovering from ulnar neuropathy of the left elbow, you would begin playing in the thumb position as demonstrated in the illustration on the left, as the elbow flexion is less extreme, and therefore there's less pressure on the nerve compared to playing in the position seen in the right-sided picture. Likewise, playing the piccolo requires a great deal of elbow flexion and puts a lot of pressure on the ulnar nerves. Since most piccolo players play the flute as well, one could begin practicing on the flute if that was acceptable to the player, therefore reducing stress on the nerves at the elbow. One could then gradually transition to spending more and more time on the smaller instrument. If the violinist or violist has left-sided ulnar neuropathy, one should initially avoid playing in the higher positions due to the degree of elbow flexion. One would start with the left hand closer to the scroll and gradually work up the neck towards the body of the instrument. If a brass player has a lip injury, for example, one would initially avoid playing in the higher registers, as this requires more pressure against the lips. This is particularly true for trumpet or French horn players, as these instruments generally require increased pressure of the mouthpiece against the lips compared to trombone and tuba. Decurvain's tendinitis. Please refer to Chapter 9 in my book. This condition refers to tendinitis on the thumb side of the wrist. These tendons pass through a tight tunnel just where the thumb meets the wrist. And you can see it in this picture just opposite the third caption from the bottom that says radial artery, that points towards the red line, which is the artery. Just adjacent to that on the right is a little tunnel that the tendons dive through. The tendons have a tendency to become irritated and inflamed in that tunnel, and the position of ulnar deviation of the hand, where the hand is deviated towards the pinky side of the wrist, and also when the thumb is adducted or brought across the palm towards the pinky, tend to irritate this tendon even more. For the violin or viola player with right Decurvain's tendinitis, one should initially avoid using the third of the bow closer to the hand in order to avoid the position demonstrated here. For the left hand, one should avoid playing in the higher positions in order to avoid the position seen here. For the bass guitar player, it might be helpful to make the shoulder strap longer, as seen in the picture on the right, as this allows one to play with a more neutral wrist position. Many people can perform or successfully play with the position seen on the left, however it does predispose one towards wrist problems. For the guitar player, similar to carpal tunnel syndrome, one should avoid big stretches and barred chords at first and gradually work up to these. For the pianist, for example, one would avoid starting in the mid-range of the instrument due to the amount of ulnar deviation seen in this position. This is especially true when the thumb is playing on the black keys due to the increased ulnar deviation, and one should stay away from this at first. In general, setbacks are to be anticipated in this program, and one should advise the musician that 2 steps forward and 1 step back is the rule rather than the exception. In this manner, discouragement will hopefully be avoided. One must guard against impatience. Remember, hurry slowly and you will soon arrive. Thank you.